everyone. So today's topic of discussion is leptospirosis. Leptospirosis is a zoonotic disease with worldwide distribution, and the organism responsible for it is a spirochete of genus Leptospira. Leptospira has two broad species, that is Leptospira interrogans, which is the pathogenic species and consists of over 300 serovars. The second one is Leptospira biflexa, which is non-pathogenic and is actually a saprophyte. Leptospira doesn't show any direct human-to-human transmission. It is transmitted from animal to human via indirect contact, that is, consumption of any contaminated water which is contaminated with the animal urine, or direct contact of animal urine or products of parturition with the human mucous membrane or through skin abrasion. The important mammals responsible for the leptospira and serve as a leptospira source are rats, dogs, cattle, and pigs. The leptospirosis shows a seasonality pattern and is more common in rainy and post-monsoon periods, particularly after floods. The three important epidemiological determinants which are responsible for spread of leptospirosis can be remembered by a mnemonic 3 Rs, which stand for rodent, which serve as a vessel for leptospira, rainfall, which leads to flooding and contamination of water source, and rice field, which serve as a source of stagnant water where it gets contaminated by the animal urine, which has leptospira. The clinical features of leptospirosis can be divided into two broad syndromes. 90% of the patients present with mild anictic febrile illness, which is actually a flu-like illness, and the patient presents with fever, headache, body pains, mild nausea, vomiting. Whereas the 10% of unfortunate patient develops severe leptospirosis, which is also known as Weil's disease. Weil's disease is actually a triad of hepatic failure, which presents as jaundice, renal failure, and third is hemorrhagic manifestation. These hemorrhagic manifestation can occur in the form of pulmonary hemorrhage, any gastrointestinal hemorrhage, or conjunctival hemorrhage. Thus, Weil's disease progresses rapidly at a case fatality rate of 5 to 15%. In this image, we can see a patient with severe leptospirosis which has developed icterus and conjunctival hemorrhage. Here in this chest X-ray, we can see bilateral pulmonary infiltrates, which were actually pulmonary hemorrhage in a patient of severe leptospirosis. The gold standard test for the diagnosis of leptospirosis is a serovar-specific test, that is microscopic agglutination test. This test detects antibodies against the specific serovars of Leptospira interrogans. Other genus-specific tests are also available, that are ELISA-based test and immunochromatographic test, which detects Leptospira IgM and IgG. Other investigations by which we can diagnose leptospirosis are we can isolate leptospira from the patient's body fluids by using special culture media, that is EMGH culture media or Korthoff media, and we can also directly demonstrate leptospira from the patient's body fluid using the dark field microscopy. The treatment of leptospirosis depends upon its severity. If it is a mild leptospirosis, the patient can be prescribed oral antibiotics, that is the doxycycline or amoxicillin, for 7 days. In case of moderate and severe leptospirosis, that is the Weil's disease, the patient should be started on intravenous antibiotics, that is intravenous third generation cephalosporin, that is ceftriaxone or cefotaxime, or the patient could be started on doxycycline 200 milligram IV bolus followed by 100 milligram every 12 hourly. This is for it today, guys. Thank you.